Dr. Gum, last time you were on the show, you were teaching doctors your procedures and protocols in the reversal of peripheral neuropathy. So we want to introduce Dr. Aaron Gum, author of Blueprint to Neuropathy, and Dr. Derek Southers of ReMed Wellness Clinic. Nice to have you all with us today.
Thank you.
Yeah, thank you for having us. You know, it's always a blessing to be on here. I appreciate you guys having us on again. I've been fortunate to be able to teach hundreds of doctors across the country on how to reverse peripheral neuropathy. Dr. Southers here is one of my first proteges, and I'm excited to be able to have him on here.
So, Dr. Southers, tell us a little bit about yourself and your working with Dr. Gum.
Well, I want to make sure the viewers know I'm not a medical doctor. My doctorate is in metaphysics and metaphysical research, which is basically the practice of natural processes. To give you an example, before I came to work for Dr. Gum, I actually did rehabilitation work for the NFL and Major League Baseball, trained a number of the Texas Rangers. In fact, we're currently treating a Dallas Cowboy right now. Working with Dr. Gum, though, that changed everything. He taught me over years and years of studying the approach of peripheral neuropathy, and it's changed my life as well as our patients.
Okay, well, let's talk about peripheral neuropathy for just a minute here for folks who aren't familiar with it. What are the signs and symptoms?
Jane, that is such a good question. Here lately, and it seems to go in seasons, we have so many people coming in saying, I really can't describe it because it's a pain they've never experienced before. It's frustrating to them. The common signs are burning, numbness, pins and needles, electrical shocks going up their leg, and sometimes even in their hands. The feeling of wearing socks when they're not. But the biggest issue, the one that we really put an emphasis on, is the loss of balance. We don't want these people falling.
Okay, no, that's such a, particularly as people get older,
Yes,
that's something
ma'am.
you have to be very, very careful about. So you say that you can treat neuropathy without drugs, injections, or surgeries. So Dr. Gum, exactly what do you do?
Yeah, so when you look at a nerve, it has a outer coating called a myelin sheath. That starts breaking down.
Science class. One of those science classes.
It starts breaking down because the blood vessels aren't getting blood to the nerve. So we use cutting-edge technology like infrared therapy. Our device has 21 white paper studies behind it for neuropathy. We have a stimulation device that we use. All the cancer centers of America across the country use this same machine, so if they can put their stamp of approval on it, we can too. We have a study around nitric oxide production. It's around a Nobel Prize winning concept that we address inside of our program as well.
So, Dr. Southers, what kind of success are you having at your clinic with these kinds of methods? Tremendous
success. The same success I had when I was working with Dr. Gum at our original clinic. At ReMed Pain and Wellness now, we're seeing around the 90 to 95% success rate. Folks are walking in and they're confused, Jane, because they'll go to a primary care physician, they'll go to a neurologist, and they're given medications, they're given injections, and they're asking, but can you tell me why I have this? When they come to our clinic, we address that underlying issue. People that walk in with numb feet, they begin to get the sensitivity back. People that come in with their feet burning begin to calm down. And most importantly, as I addressed earlier, the folks that come in that are afraid of walking, Jane, we have people that come in on walkers and canes, and they're leaving walking out with them. So we're restoring balance.
To be able to give
it
people.
Is wonderful, Jane.
That definitely is. So, Dr. M, what are the actual, you mentioned a couple of percentages. What are the actual percentages of people who have significant results?
Well, teaching hundreds of doctors across the country, typically about a 90 to 95% success rate.
Wow.
It's a chronic condition, though. So if viewers are listening today, if they're relying on drugs, surgeries, injections, and they think they're going to get healthy, they need to start thinking a little differently on addressing the underlying cause, okay? So if they're relying on that, make sure that they're going to call in and take advantage of the offer that Dr. Southers has with ReMed Pain and Wellness.
Okay.
You know, a very wise man once shared something that I thought was profound. He said, if you want to feel something different, you need to be willing to try something different. So what we're doing is we are offering a free seminar to the first 25 callers that are watching this program. It's a no obligation seminar. We want you to come in and let us talk with you. We want to address what you're dealing with. We want to give you real answers and real expectations to where you are and where we can possibly get you.
All right, that sounds great for people because you do need to get to the root cause of some of these things instead of continuing to treat them.
Yes, ma'am. You're exactly right, Jane.
Thank you so much. Good to see you all again. You can call this number for more information. The number is 214-221-2588. For more information on ReMed Pain and Wellness, they are on Beltline Road in Dallas. You can also, of course, go to remedwellness.com.